This is Psychology 6506, Abnormal Psychology. Today I'm going to talk about diagnosis. Now, diagnosis is a little intimidating for some people because you're often worried that you're putting a permanent label on someone. And you're worried about the consequences of that. But really, diagnosis can be very useful. It narrows down the available treatments, and it exposes you to a whole body of research about what's useful for that particular client. Now, the DSM-IV TR, text revision, is the current diagnostic manual. It can be a bit intimidating because it contains hundreds of diagnoses, which makes the diagnostic process seem overwhelming. In reality, there's only a few diagnostic categories that you need to be concerned with in any particular setting. I work for Orange County Behavioral Health Services. They run outpatient clinics for people with severe and persistent mental illnesses. And it could very well be that you would be involved in a similar setting, a publicly funded outpatient clinic. Generally, there are about 5 diagnoses that account for about 80% of the patients. These are schizophrenia, major depressive disorder, schizoaffective disorder, bipolar disorder, and substance dependence. These are conditions that tend to be chronic and tend to be very impairing. Often these clients with these chronic and severe conditions are not employed. Often their families have abandoned them. So these are severe conditions and account for a large part of outpatient diagnosis. Now, in a general outpatient private practice, you'd be seeing less people with less severe diagnoses. So generally you're going to see people with anxiety disorders such as general anxiety, post-traumatic stress, social anxiety, phobias, depression. In addition to major depression, you would see people with dysthymia, which is more chronic and not as severe. Adjustment disorders are going to be very common in a private practice. Someone has had an experience that's upsetting to them, and it's generally time limited, their reaction to it. Substance abuse and dependence, of course, are common problems. Personality disorders, generally someone wouldn't come in with a personality disorder, but because of their personality disorder, they have difficulties in relationships, and the distress caused by that brings them in. And relationship problems are very common in outpatient practices. If you also see children, you're likely to see behavioral problems, parents bringing in their children for behavioral problems, and these include attention deficit disorder, oppositional defiant disorder, and conduct disorder. Some other diagnostic categories that might require more specialized treatment, and if you have a general private practice, unless you specialize in one of these things, you'd often refer them to someone who does. Autistic spectrum disorders such as autism and Asperger's, dementia, gambling and impulse control disorders, eating disorders, mental retardation, learning disorders, communication disorders, sexual disorders, sleep disorders, and somatoform disorders. Now, all of these have specific treatments and generally require a specialist. Now let's talk about the diagnostic process. What are the actual steps you'd go through when someone comes into your office and is sitting across from you? You're going to start with a presenting complaint. You're going to say, what can I help you with today? And they're going to tell you, I'm depressed, I just had a divorce, I feel anxious all the time. They're going to give you their version of what's wrong. You're also going to consider the referral source. Were they referred by the court? Did their spouse bring them in? Were they referred by their school or their work? So all of those things factor into what's going on. The first thing you need to do is rule out non-psychiatric medical causes. Let's say someone tells you their heart beats hard all the time, they have trouble getting to sleep, they feel very anxious. Maybe they just started on a diet medication and that's causing the symptoms. So you certainly don't want to spend months doing psychotherapy with them when simply discontinuing a medication or another medical cause might be causing their problems. So you want to include those things in your diagnostic interview, and also if they haven't had a recent physical, you want to refer them for that and to consult with their doctor. Then you're going to narrow it down to broad diagnostic categories that are consistent with the available information, and you're going to gather additional information that's needed to arrive at a final diagnosis. So you might need to talk to their family, you might need to talk to their teacher or a previous counselor or their physician, and using all that information, you're going to narrow down the diagnosis. You might give a preliminary diagnosis in the first session, such as psychotic disorder not otherwise specified, or designate the diagnosis as provisional. And as you continue to see them, you can get more specific about the diagnosis. Now in the DSM, there are 5 diagnostic axes, so let's talk about those. Axis 1 is all mental health diagnoses that are not on Axis 2. So that includes depression, anxiety, and everything else. Axis 2 is only mental retardation and personality disorders. Axis 3, general medical conditions that are related to the understanding or management of the mental health condition. So that's an important caveat. Someone might have foot problems, but if that's not related to your treatment, if you don't need to know it in order to know what medication would be best for them, or if it doesn't affect their mental state either directly because of it leads to a chemical imbalance, or indirectly because they're worried about it, if there are none of those things, then you don't need to give an Axis 3 diagnosis. And it would be fine to put deferred on Axis 3. Also, as a mental health practitioner, you're going to put the source of your Axis 3 diagnosis, since you didn't make the diagnosis directly. So you might say ovarian cancer by history, by client report, state the source of your diagnosis. Axis 4, psychosocial and environmental stressors. This is where you would put things like academic problems, recent divorce, unemployment, things that are stressors that are affecting your client. And Axis 5 is the GAF rating, General Assessment of Functioning. It's a scale from 1 to 99 that gives an overall description of how the person is currently functioning. You can put a current rating, and also you can put highest level over the past year. And that GAF scale is found in the DSM manual.